So thank you for coming. So I was in the last session. It was quite nice, quite interesting. So now we go back to health. So I see a lot of women here. So why am I here today? Well, we're talking a bit about breast health, okay? Breast health is extremely important. Can we have a slide? Good. Okay, because, okay, don't want to scare you, but breast cancers are very, very common, okay? It is the most common cancer in female cancer in Hong Kong, and it is the second most common cancer in the world, okay? So extremely, extremely common. And in Hong Kong, out of 13 women, 1 will have breast cancer. And in the US, out of 8 women, 1 will have breast cancer. You might even know someone will have breast cancer. So that's why I'm here. I do important things in life. However, I just want to tell you, we're not that scary. We're doctors. We're not that scary. Most of the time, when people come and see me, they're really talking about benign disease, okay? Most of the time, it's just like a little fibroadenoma, a cyst, or an abscess. So before I go on to topics on why we get breast cancer, I want to clear some myths. These are things which I get phone calls or WhatsApp in the middle of the night when friends want to ask me about these things, okay? So only women have breasts. No, okay, we have male here. You all have breast tissue, and you can get breast cancer too. Although your breast cancer risk is only 1 out of 1,000. So out of 1,000 men, 1 will get breast cancer. And indeed, men can have mammograms too. We hate our mammograms, right? They should have it too when they get sick. You have thin breast tissue, but you can have mammograms too, okay? And the treatment is relatively the same. Okay, I get a lot of this. I have pain. I must have breast cancer. And they come to me to get really, really scared. Basically, pain has really not much to do with breast cancer. Most of the time, pain is not actually breast cancer, okay? The important thing is that you know that, okay, maybe there's some symptoms, then you check for other symptoms to make sure that you see a doctor. The worrying signs and symptoms would be breast mass, bloody nipple discharge, when the breast gaze asymmetrical on both sides, maybe some nipple retraction. I really want to point out, sometimes for the very thin women, they come and tell me they have a mass. Actually, if you feel a mass and you're very skinny, feel along it. If it's long, it's just your rib, okay? It's not a cancer, really, okay? It happens. Bigger breast size give you breast cancer. No, okay? Not at all. Nothing to do with size, okay? This is weird. I got asked that quite a few times. Wearing an underwear bra or putting a mobile phone in your bra causes breast cancer? No, but I don't know why people put a mobile phone in their bra at all. Just don't get it, okay? Not true, okay? Okay, do not eat chicken, okay? The poor chicken, nothing is wrong with the chicken, okay? It's to do with the estrogen, okay? Because when people have poultry farm, they want to grow them, and therefore they inject hormones into them. So nothing to do with chicken but the hormones. But in fact, there are some studies suggesting that if you eat white meat, chicken, and less than red meat, maybe the risk of breast cancer is lower. There are some studies, okay? Okay, I'm too old to get breast cancer, or I'm too young to get breast cancer. Well, have a look. So from 25 years old onwards, you can get breast cancer. And the median age is 58. We're slightly lower compared to Western people. So Asian population get breast cancer slightly younger, okay? And this is important. When you have a symptom or a lump, you may not need surgery, okay? I am a surgeon, okay? But if you get scared by it, someone say you have to have surgery tomorrow before any biopsies, don't do it, okay? We need a biopsy. We need to know what we're dealing with before surgery. Okay, so earlier diagnosis does make a difference. The overall survival of breast cancer is about 85%. It's not bad. But if you present at stage 4, that's when it's spread, it's 30-odd%. So the purpose is to find cancer early. So why do we get breast cancer at all? There's no one reason. People tend to try and find a reason. Have I done something wrong? Or is it because of a specific reason I get it? In fact, we call it multifactorial. So it's many, many, many reasons, okay? The major reasons we know, age. Usually when you're 50, 60, more risks. Estrogen, very important. I'll tell you a little bit about estrogen, okay? And genetic factors, of course. If you have family history, there's a genetic mutation, you get it, okay? And how you live. And I'll try and cover this a little bit with the short time I have today, okay? So estrogen factors, puberty. When you get to puberty, you start having menstruation, right? That's the estrogen cycle when it starts. When does it finish? menopause, okay? So the theory is that the longer you have these estrogen cycles, your menstruation, the higher the chance of breast cancer. So as you know, long time ago, people get menstruation at the age of 16, maybe. Nowadays, maybe you have children who's 9, okay? So it's our fault. We are living too well. You eat too well, you don't do exercise. Affluent countries, okay? So basically, that doesn't help breast cancer. Now, pregnancies, okay? If you get pregnant early, before 30, okay, you will reduce risk of breast cancer. The more kids you have, the better, okay? So this is me, breast surgeon, telling you, you should have kids, really, okay? And try to have them before 30. Not easy, but you should, okay? And breastfeeding. Breastfeeding is good for the baby in terms of immunity, but it's also good for you. Again, it breaks this hormonal cycle. That's why it reduces breast cancer, okay? Last but not least, estrogen, which is taken into your body, like hormonal replacement therapy. I can understand when you're sweating, you're in a bad mood, all sorts of terrible things which happens in menopause, take the pill, no problem. But there are some women who take it for beauty. They want to be beautiful forever, okay? So they take hormone replacement therapy for like 10 years, 20 years. Well, that's a risk of breast cancer, okay? So not worth it, okay? Right. So now I want to talk a bit about genetics. Whenever we think about genetics, Angelina Jolie comes up. Why? Because she's the best advocate I've ever had in my life, okay? No matter how many talks I give, she came out, the world cares about BRCA mutations. So she has family history of breast and ovarian cancer. She found that she carried the most common gene which causes a breast cancer when there's a mutation, which is BRCA, and she decides to do prevention surgery, okay? So this is what happens. When you have a risk, you could prevent it by doing surgery. A bit drastic, I know, but it does prevent the cancer. What I want to tell you is in life, our life is not so easy. BRCA is just one of the genes which causes breast cancer. Nowadays, you can go to Watson's and get the kids and do a genetic test, right? I wouldn't recommend that, okay? If you want to do a genetic test, come and see us, okay? So there are some genes which is not BRCA genes, which is related to breast cancer, maybe rare. For example, a TP53 gene. If you get that mutation, you get all sorts of cancers. You get breast cancer at the age of 20s, really early, okay? So there are also a lot of unknowns, as you can see. There are lots of little genetic mutations which we don't understand about. And me, apart from running a charity, I'm actually a professor in the University of Hong Kong, do research on this area. The other thing which is very important about these genes is that it controls your repair pathway of your DNA. Every day, something goes wrong with your DNA, trust me, okay? And our body knows how to repair it, except when the gene goes faulty, then it does something wrong, and that's why you get this disease and cancer, okay? This is Hong Kong data. If we test women who have family history or who are very young with breast cancer, about 15% of them will have a mutation, and 5% of them are not BRCA mutations. So we do get it in our locality, and most of the time, when it's hereditary, you get multiple cancers in the family, you get very young onset of cancers, you also get certain type of cancers, okay? And remember, not just females, we talk about breast cancer, but male can carry these mutations. Even if they don't get sick, they can pass it on to the next generation. So we need to test everyone when we suspect there's a mutation in the family. And how does it pass into the next generation? 50%. So only 50% of your children will get this risk if they get the mutation, okay? So basically, you can't guess. Even if I have a whole family of cancers, you still need to get tested. You cannot assume that you have the gene mutation or not, okay? Need to be tested. And in Hong Kong, our criteria is very much similar. As I mentioned, young onset cancers, multiple cancers, ovarian cancers, etc. You can test the cancer patient, or you can test a non-cancer individual for the mutation as well. So why do we want to know this, okay? We want to know the risks, because for us doctors, there's something we can do about it, okay? We want to know your family risks, okay, so that we can do some prevention, or we can do some lifestyle modification, okay? And of course, for medical purposes, we can do screening. I'll show you a little bit about it. And for something new, for the past few years, actually there are drugs, they're medications which are specifically designed for genetic mutation carriers. Okay, so it is important to know. Screening, usually when do I screen? Everybody says the wrong number, right? Okay, about 40. Usually go to screen about 40. But if you have a genetic mutation, you can get cancers in your 30s, right? So we start screening at 25 years old, and we would not only use your non-favorite mammogram, but we add MRI scan. MRI scans are extremely good, extremely sensitive, but sometimes a bit too sensitive for normal population. So we use it on high-risk individuals. This is Hong Kong data as well from the Hong Kong Hereditary Breast Cancer Family Registry, which is my charity and my database and everything else, okay? Basically, if we screen women who have no symptoms, usually we catch 2.3 cancers per 1,000 women. But if I were to screen someone who have a mutation, it's 10 times. I can catch 25 women each 1,000 women screened. Okay, we go back to your non-favorite mammogram. I have to put this in. So can I please not have a mammogram, please? Okay, you can't. As you can see on the right side, okay, over there is some microcalcification, the white dots, okay? Those can usually only be seen on mammograms, okay? So even when MRI scans and ultrasounds are good, we'll miss early cancers. We don't do mammograms. So sorry, you really have to have mammogram. Don't trust anyone who tells you something can replace mammogram. Not yet, okay? And for the genetic test I mentioned about drugs, there is a targeted therapy just for mutation carriers. So it's very important that we test these women nowadays. Okay, so this is my charity. So why am I standing here apart from being a doctor? So I raise a lot of funds, okay, to help women who are at risk, these families. In Hong Kong, these screening programs are not sponsored yet. The drugs are not completely sponsored yet, and we've raised a lot of funds to help that, and we've also do education, like today, right? We do education to teach you about genetics. Okay, the last 10 slides you'll love. These are not the normal conversation I have in my clinic, but I know you want to know, okay? So dietary fat, okay? Is dietary fat important? Yes. Basically, we know that fat intake actually increases risk of breast cancer, okay? By reducing a dietary fat, it actually improves the breast cancer mortality, okay? Now, alcohol. Best not to drink. I turn a blind eye to my patients who want to have a drink, okay? But basically, if you drink alcohol 2 to 3 drinks a day, there's a 20% higher risk of breast cancer. That's quite high to me, okay? Now, the next paragraph is interesting. In UK, people like to do binge drinking. So they don't drink all week, or they don't drink 2 weeks, then they spend 1 weekend just getting drunk. They actually did a study, okay? Even if you just drink 1 day in a month, your risk of cancer is already higher. So honest truth is the best not to drink if you can. If you really want to drink, drink less, okay? But the good thing is, folate. Folates are in spinach, okay? Folate supplements, actually they counteract the risk of alcohol in breast cancer. So for those who really want to drink, I tell you not to, but really want to and I can't stop you, take some folate, okay? That's good for you. Fruits and vegetables, so these are certainly reduces risk of breast cancer and many types of cancer. But if you drink fruit juice, that's not good. It increases the risk. And that's to do with the sugar level, okay? And also the fibers that we don't have in fruit juice. Dairy products, nothing to do with dairy products, okay? Breast cancer has nothing to do with dairy products. The only thing which might be associated would be the fat, if you get obese, okay? Cigarette smoking. This is 100%, 110% no, okay? So cigarette is good for nothing, okay? I hope there's no one who's in the cigarette industry here. Basically, it really, really increases risk of any cancers you can think of, cardiovascular disease, everything, okay? Soy. Everybody wants to know about soy, right? Okay? This has been a myth forever. My theory is if it's forever, that means that it's not strong evidence, right? Okay? So basically, the largest studies show that soy doesn't increase risk of breast cancer. In fact, sometimes they feel that soy might even improve survival from someone who had breast cancer. What they really thought is that if you just take natural soy, it's fine, but don't take supplements because they're very concentrated, okay? So this is the myth of soy. No myth at all. It's not really related. Exercise, okay? Exercise is very good. It helps the cardiovascular system and it helps breast cancer. Of course, there are data suggesting that if you do like 2 to 5 hours of moderate physical activity or 1 to 2 hours of vigorous activity, you can reduce 10 to 25%. You say, I can't do it, I can't do marathons. Fine. So you walk, okay? So you walk maybe just 30 minutes a day, okay, brisk walking. You can reduce your breast cancer risk by 3%. That's not bad, right? Not bad, you can do that. So what can you do with your diet then? You remain healthy weight to prevent obesity. Try not to drink. If you want to drink, drink less, okay? Eat low-fat diet. Eat more fruits and vegetables. It's basically important, okay? Now, I just want to show you, want to take a picture. Everything I teach you about genetics, my charity has created a cartoon character, okay? So it's originally for professionals, but actually I think normal population will understand it, okay? So if you really want to, there are these 3 little videos about genetic risks so you can better understand about breast cancer risks, okay? And for the work that I do, apart from being a professor, all the things I do outside my official work, basically the charity works a lot with the university to help healthcare planning. Because a lot of times we don't get funding, we have to prove. So we get data with the help of the charity. I do the research, it's me again, okay, in the university. And we've managed to create really high-risk clinics for genetics. We've managed to talk to the government now to talk about high-risk screening. So there's a lot of work to be done so that more people can benefit. And I wrote a book. I wanted to, and a publisher came up to me and said, can you write a book? Actually, I wanted to write a children's book, but she said, no, you have to write a breast cancer one. Okay, so I created a book about stories, breast cancer patient stories, but actually how they changed my life, actually, not really just about a story. So if you're interested, more than happy, it's Chinese though, okay? So more than happy that you can look for this book. And so, my final 2 slides, so it's breast cancer in the genes, it is, of course, right? So it can't change genetics sometimes. However, we have to understand that you have a risk, and we can do something about it by doing individualized management, but there is something you can do. So you can't change your genetic genes, right? You can't change a mutated gene, but you can change your lifestyle. You can change how you behave in life, because the ultimate risk is not just a gene mutation, but the interaction of the gene mutation with what you do, the environment. So you can. So active prevention is definitely better than treating you. There's a lot of things we can do to treat you, but it's better not to get cancer, right? Okay? And of course, risk-based screening. If we do get cancer, we detect it early, the survival rate is very high, really, okay? So we can treat you. So thank you very much.